Hello, sir. I would like to ask some questions.
Sure.
What are the factors in diabetic retinopathy?
Diabetic retinopathy, the main factor is diabetes, and if it is uncontrolled, it poses an additional risk to the patients. However, we see patients who are well-controlled diabetics and still have diabetic retinopathy. Diabetic retinopathy is one disease which is associated with something called as metabolic memory. The metabolic memory means at the initial stages of diabetes, the control of diabetes at that stage, if it is very uncontrolled, would, irrespective of a good control later, can still cause problems like severe diabetic retinopathy forms. However, at the other side, if the diabetes is well controlled at the initial time of diagnosis, later on, even if the diabetes is little fluctuating, still the patients might not have much symptoms. However, this disease is also associated with additional risk factors like smoking, genetic risk factors, obesity, lack of proper diet, lack of physical activity, and any other additional diseases like hypertension, which can compound the effect of diabetic retinopathy in the eye.
And what are the main symptoms?
Initially, patients might not have any symptoms at all. So that is the importance because patients who have no symptoms can still have significant and very advanced forms of diabetic retinopathy. And sometimes they come to us at the stage when they have a first symptom and they are already in a end stage of diabetic retinopathy. So this is to stress that these patients need to have a periodic follow-up or review with an ophthalmologist, specifically a retina doctor, who would make sure the retina is not affected, at least it does not go to a preventable loss of vision. The symptoms when they start initially can be just blurring of vision. Some patients might experience distortion of vision of forms of images. They might also have floaters, which is an indication that there is bleeding into the eye.
Can eye drops help in diabetic retinopathy?
Unfortunately, eye drops don't enter the eye in significant concentration to control the diabetic disease. And for that same reason, we have to inject the medicine into the cavity, into the eye, where the medicines would then be in close proximity to the part which is affected, and then the effect can be expected.
Thank you for the valuable time.
Thank you so much.